Hello and welcome to the interview series. I am Prakriti and I have the privilege of interviewing my teacher, Dr. Lavina. Thank you, ma'am, for being with us. My pleasure. We'd like to start with your early days. So, what was your earliest exposure to a doctor and how did you decide that you wanted to become medicine?
Yes, so my mother is a doctor and she was an inspiration to me. And of course, in those times, we had only medicine, engineering, and maybe a CA as a profession to choose from. And thus, there was actually no choice for a good student to do anything else. I mean, even parents would put pressure, oh, you have to achieve something in life. So, out of the three, medicine was my choice.
So, when you did your undergraduate, okay. So, what were your earliest memories and how did you find the study environment?
So KM is a very good institute for academic studying, and of course it's like the best of the best do reach KM. So it's very good if you want to achieve great. However, I would say KM does not allow you to develop your personality to a greater extent than it should. I mean, it's more oriented towards getting a person to study well, to get good marks, to be a topper all the time. So there is a lot of competitiveness, there is a lot of pressure. Of course, it helps you because it makes you a better and a better doctor. If you want to be the best of the best, yes. But to some extent, I feel that there should have been a little more leeway, a little more openness where you are allowed to do other things, you are given time to do other things, and you try to balance it out and develop your personality as a whole. To some extent, it also depends on the individual. So, maybe KM would be the best institute to be in for academic purposes, definitely.
What time did you decide that you wanted to take up respiratory medicine and what made you take that decision?
So respiratory medicine was the reason I took it up was because surgery I felt was not a branch for me. Because surgeons are more aggressive, they are more go-getters. I have a personality where I would like to think about things, analyze things, and then treat the patient. So I thought medicine was my first choice actually. But then I also realized that after that I would have to do a super specialization because just doing general medicine would not be enough. And therefore I thought that since chest medicine is almost like a super specialization, though the degree is MD, so that was the reason I decided to take up chest medicine. Apart from that, of course, respiratory physiology is something that I love. There's a lot of understanding involved. It involves physics, it involves analytical and logical abilities to understand what is going on in the system, and that was the reason to take up respiratory medicine.
How was your residency like as a chest physician?
Yeah, KM it was tough because there's a lot of workload, there's a lot of hours that you have to put in, and you're always understaffed as far as residents are concerned, at least. So we used to work maybe 24 to 48 hours a day also without taking a break. In KM, we also had a dedicated intensive care unit. So we used to first do our shifts over there and then do the ward work and then look after the patients and the OPDs. So yeah, it was tough, but then looking at seeing so many patients really helped in developing my abilities as a doctor. So it was a great experience working in KM.
As a respiratory physician, what are the differences when one practices privately versus when one practices in a hospital?
So in a general hospital, we are more geared to diagnosing the patient. We would like to exactly know what he is suffering from before treating. Having said that, it is not that we don't give symptomatic treatment. We do alleviate the patient's symptoms so that he is not distressed. But we are here to maybe doing more investigations, maybe more invasive procedures to achieve a diagnosis before you treat. While in the private sector, maybe because of so many other considerations that they try to start the treatment as early as possible. So sometimes, especially with diseases like tuberculosis, we find that patients' sputum test and all, though it's done, and if it is negative, other investigations are not done to actually find out whether the patient really has TB or not, and the treatment is started. And then we get these complicated cases where the treatment has already been started, patient is not responding, and then we have to go all over and do investigations. So there's a lot of time lost, which maybe doctors are not understanding as yet. In the sense that suppose the patient's diagnosis is not actually TB, say it's a malignant process because that can mimic TB, then you have lost a lot of time by giving treatment without investigating. So that is a major difference there. Although chest physicians per se, I would say that even in private hospitals, they are taking the risk of trying to diagnose and convincing the patients to do investigations before they treat.
What drove you to commence teaching in academics?
Okay. Firstly, I like teaching. I love having students, and I love having to be in a place which is vibrant. And I feel youngsters, obviously, they bring up new ideas. They bring up things. Sometimes they are the ones who bring up topics where suddenly we have to think and we understand something which we have not understood before. So it's a great way, I would say, to learn also. I learn a lot from my students. Okay, though I would say I do teach them a lot too. What drove me into this profession, apart from my love for teaching, is also that I can strike a work-life balance with this. Because I'm here full time. I don't practice in the evenings, so therefore I'm free and I can give that time to my family. And I think it's very important. It's very important to understand that one should not go only after materialistic things, relationships, and how much time you give to other people is also a very important process of you as a human being. And I would say if you're a very good human being, you will become a very good doctor.
What is the spectrum of patients that a respiratory physician goes into?
So respiratory medicine now has grown in leaps and bounds, I would say. We have a lot of interventional pulmonology which is happening. We have bronchoscopies, thoracoscopies, bronchial thermoplasties, impulse, cryobiopsies. These are all new techniques that have come up only in this particular sub-branch, I would say, of pulmonary medicine. Apart from that, sleep medicine has become almost like a separate branch. Intensive respiratory care medicine is again a sub-branch of pulmonary medicine. Apart from that, each and every disease, now there is so much research and there are so many new things which have come up that each disease has become like a subspecialty of respiratory medicine. So we have patients, say, from obstructive airway diseases like asthma, COPD, to interstitial lung diseases, to pleural diseases, to parenchymal diseases like pneumonia, etc. So there is a gamut of patients that we see. Lung cancer again is another upcoming sub-branch of pulmonary medicine. And I would say that with the advent of CT scans, pulmonary medicine has really grown, and it is one of the fastest growing branches of medicine where a lot of new things are coming.
Ma'am, what is the most challenging aspect of practicing respiratory medicine?
I think the most challenging aspect is that still other consultants are not geared towards referring patients to us directly. Even general practitioners, only when they feel that the patient is becoming complicated or they are not able to manage, they refer patients to us. What we would like is that more awareness should be created among patients as well as among other doctors, where we, people come to us with those symptoms so that at least we can guide them properly. And I think that is the most important challenge that as a respiratory physician we face today. Though awareness is increasing, and probably what we can do is maybe have more interactions with patient groups, with general doctors, general physicians, and maybe have support groups of patients who have certain special diseases which are chronic, like asthma, COPD are also very chronic diseases. Patients are taking treatment almost throughout their lives. So having such kind of groups will probably help us in advancing respiratory medicine further.
What is the most rewarding aspect of this?
Most rewarding aspect is when a patient comes and tells us that we are feeling very, very relieved that our symptoms are gone, we are happy, we are cured. I think that, for every doctor, I would say, not only for the respiratory physician, that is the absolute pinnacle of success, I would say, that when a patient is happy and cured with my treatment. So, of course, it is also the blessings of the Almighty or whatever the power, nature that is there, which helps in curing the patient. But that is the most rewarding. The second rewarding aspect is when we diagnose unusual cases. And we have had quite a few in Somaiya Hospital actually. And that really gives a high to us, that what we have thought of as a diagnosis, and then we do investigations and it gets confirmed, and it's a rare syndrome or something very rare that we have diagnosed. It is really nice to have.
As far as patients are concerned, how does this sub-specialization and narrowing of the doctor's focus, how does it affect patient care?
I think it's a good thing for patients also, because it improves care. And secondly, unless someone is looking into the nitty-gritties of a disease, research won't happen. And for that, it is very important to be a subspecialist. Having said that, it doesn't mean that we will not take care of other patients. So, especially in India, so it's not possible that we only subspecialize in a certain disease or something like that. Though abroad it is being done. But they also have respiratory physicians who are overall respiratory physicians, and then they would then refer if they find that there's a complicated case and there is someone who is doing a lot of research on something on that particular topic, then they would refer to that particular person. So we do need general respiratory physicians. You cannot get away from it at all. But if I want to be more research oriented, then I should do a subspecialization and pick up a particular topic and go all out into finding the smaller things in it. But overall, it will help the patients, because once that happens, then newer medicines come up, newer techniques come up, and then it is applied to patients.
You've been practicing for so long. So what is the changing trend in the patients that you see over the years?
Patients are much more aware now. Thanks to Google, they ask us a lot of questions. If it is done in a good manner, if the attitude is good, then this is a very good thing that has happened. The problem sometimes arises, very rarely, that some patients may want to try and test the doctor when they come to your clinic. So that is not a great attitude to have, because you should have faith in your doctor. They should not, just because they have read 101 things on the internet, and all of which may not be true. So they should not do that. With that attitude, if they come to the doctor, then it's difficult for the doctors. But overall, I would say 99.9% of the patients, even if they read up and come, they come with the attitude to understand what is happening and to basically see to it that proper treatment is given.
Over the years, as a teacher, have you seen any difference in the students that come?
Students are smarter nowadays. Yeah, really. Maybe it's because of the overall exposure that you people have to so much knowledge that is there on the net. Because for us, it was like we had only books. So if I want to search an article, I have to go to the library. The journal may be there, may not be there, and then you physically search the article and then go through it. very time consuming, tedious process. Now knowledge is at your fingertips. So if you are a good student, if you genuinely want to study, there's nothing stopping you now. And that process, and this happens right from childhood. You are exposed to computers and overall internet, etc. since childhood. So I think that develops your brain further, and I would really say that children nowadays are more intelligent. I find their attitude also to be quite good. And especially in Somaiya, the students they all come with that sense of wanting to learn, of wanting to be good doctors. And even, in fact, recently I had an intern coming to my department, and he took so much interest, though he was actually wanting to do orthopedic surgery. But he took so much interest in my branch that he became almost like a resident for us. So that is something which is very nice that I see in students. In that case, marks don't matter. Sitting in your clinic, no one is going to come and ask you whether you got a distinction or whether you got a first class or the second class. So to that extent, I would say marks don't matter. But to be frank, if you apply your knowledge and if you are really studying well, the marks will automatically come. There's no reason for them not to come. But one should not stress oneself out. This is what I would advise all my students. And I do tell them that you just read for your sake. Don't try to say that, oh, I need 10 out of 10. Why did I get 8 out of 10? It doesn't matter in the long run.
How do you advise someone who wants to take up respiratory nurse session?
They should have an aptitude for it. Okay. If they have a love for the subject, then definitely there will be no stopping them. If you want to see it from a very practical point of view, I would say respiratory medicine today is the fastest growing branch that you will get. You will also understand that there are so many nuances to respiratory medicine that you can achieve whatever you want. Like if you are interested in intervention, then you can do interventional pulmonology after doing your MD. You can go in for critical care medicine. You can go in for sleep medicine. You can diversify into looking after a particular set of diseases or disorders. So it has a lot of scope as of today. And I said, 2 things, CT scans, radiology, even sonographies that we are doing today. Sometimes respiratory physicians are always doing lung, chest sonographies. That along with bronchoscopies and thoracoscopies. And the other nuances that have come with that, like biopsies and better instruments and better imaging, all that has really catapulted respiratory medicine to a high. And today is the fastest growing branch. So I would really encourage people to take it up.
So does that kind of help them in the longer run because they have seen so many patients, or does that not give them enough time to think about it?
Yeah, if like municipal medical college like KM, Nair, Sion, yes, the residents are overworked, definitely. But the gamut of patients that they see makes them into better doctors. Though sometimes they may be working mechanically, but still that experience never goes. So you have seen the amount of cases that are seen over there are so many, and so some of them are so rare, which you will never see in your life later on. So that experience itself makes them much better doctors. That is true to some extent. The other part is, yes, we don't get that much time to read up. So even if I've seen a complicated case, even if I've seen a rare case, I may not have read up on that. And that puts me a little behind. While in other, say in Somaiya Hospital, it's a private medical college, though we have a good amount of patients coming, but we are not totally overloaded the way KEM and other institutes are. So we do get a lot of time to read up and to understand and then apply our knowledge to the patient's condition. So I would say Somaiya has a very good balance between patient workload and between academics. and that would make us, I think, students of Somaiya better doctors than going to KEM or other places.
I just like to conclude with one last question. How do you picture medicine as a field in the next 20 years?
As long as people get sick, medicine is never going to vanish. There are governmental policies which are not very encouraging for our kind of medicine. They are trying to promote more of your local branches of medicine, which is not a bad thing if it is done scientifically. Scientifically, even those branches need to come up. Allopathic medicine is more oriented towards evidence-based medicine nowadays, and that is a very good thing to happen. Because unless and until I have proof, I am not going to apply that treatment, which is something which has developed over so many decades, and that develops a scientific attitude towards doing things. So our branch of medicine is never going to phase out because we are doing things very logically. We are doing things to the best of our abilities, and we are seeing the results and then applying whatever we have to do. So in that sense, it is going to progress, and there are going to be much more breakthroughs in medicine. I hope, especially with genetic therapy and with we are doing whole genome sequencing for most disorders. So as we go further and further, we will have what I would say is called precision medicine, where it is individualized medicine, and individually I will treat each patient. And once we reach that, I think there's no looking back.
Thank you so much, madam, for such a lovely. It was really
Thank you.